we want to look at Module 5. I just feel that it is important to bring this aspect into it as part of the introduction to data management and analytics. We need to realize that intuitive interrogation of the data is a key component of a skill that we would have to develop. Intelligent interpretations are also very important. I will just try and give some examples from some charts, and maybe it will help to develop an insight. Then we'll look at the informed decisions spectrums that while we do analytics, we need this informed decision from the insight to be able to deal with some aspects on the healthcare delivery system, okay? What it is to rely on data, hard data is very good, but I have this, what would I say? I want to champion a school of thought that makes people to understand that apart from hard data, there's what we call gut feeling, or what you want to call intuition, okay? Because we are human beings, we are spirits, we have intuition, and intuition can also guide us, to make certain decisions. It's very important. Yes, hard data is evidence-based, data-driven, is meant for decision-making, it's more reliable and all that, but I can tell you that it's possible for us to blend both our hard data and our gut feelings, okay? It's very important. So we can talk about that in a very more detailed class. Intuition is also very important as much as because the intuition never goes wrong. That's the important thing. It's just that it sounded like a babalawo kind of thing, and nobody wants to do that kind of. So I just feel that we should do this, and it doesn't really go well with when you compare with. We have seen that there is 20% rise, and because of this 20% rise last month, I think we can increase consumption, we can increase consumable, we can increase this. That's quite straightforward. That's quite objective, non-biased, and all that. Okay, so it helps a lot. But I hope I have another chance to talk about this so that we can understand how gut feeling and intuition plus hard data can work out very well in what we do. Now, intelligent interpretation of data. I want to talk about something very important. This intelligence also driven by intuition, okay? You would have to be able to look at a data that has been transformed, manipulated, and presented as a chart. When you have a chart, it becomes very easy for you to interrogate it and make intelligent interpretation. Now let's look at this plot. This plot is a research work. They were trying to look at neonates, those that are nourished and those that are malnourished, okay, when they were born. So you would be intelligent in your interpretation if, first of all, you're objective. What it also means to be objective is that you're guided by the objective of the work you're doing. For example, as a research, when you set out to do research, you set up some objectives. And when you set out the objective, that becomes what guides you in running your analysis and coming up with a conclusion. You would not want to come up with a conclusion or draw some inference or try to make some interpretation of your data based on something outside the objective or the core reason for which that research was set up. So it's very important. That helps us to be more objective because we're guided by some kind of framework, okay? So the objective in research, it's very important. Then if there are no objective, for example, you're just an analyst, remember you're a data scientist, you're a data manager, you can just get a bunch of data sets and do some kind of analysis on them, extract some insight that people can see, okay? So it gives you a way to take charge and you can give a direction to what it is you want to do, okay? And you have to have a mind of being very flexible and see a lot of possibilities, okay? So let's look at this chart now and try and see how we can interpret this. For those who are very good in statistics, this is a Gaussian distribution plot, a histogram, okay? Frequency plot is looking almost normally distributed. Okay, these are kind of interpretation that will be coming out from this because that's the reason we are plotting this. That's the reason we're putting this red Gaussian normal distribution curve on top of it. If you have a chart that has this Gaussian curve on it, and then you didn't mention anything about it, it doesn't make sense, okay? So you have to mention what you have projected on a plot so that it is clear that the reason for which the plot is actually made and the reason for which that is done. Okay. Now look at this. If you look at the plot very closely, you would see that there is a boundary here in which a classification was made. It says when it is less than 25 CAN score. This CAN score scale is a scale in which they use to measure nourishment and malnourishment in neonates, okay, or children. So from 25 backward, from this range backward, they are all malnourished, and there are about 62 of them, and they consume about 33%. Okay, so and from this side up that way, once it's greater than 25, it means that you're nourished. And the population of children around this that much, they're about 128, constitution about 67%. Okay, so you're plotting a graph, you're describing the graph, you're labeling it, you're presenting intelligent information on the chart. So somebody's looking at it, is describing, is understanding exactly what is happening. So, and for you, a data analyst, a data scientist, you have to see beyond this. Now let's look at this graph very closely again, closely again. Let me just share an experience of what I have seen in this graph that we used to start up a different study. And that's exactly what an analytics person should be able to see. Now, if you see, look closely between 23 and 25, okay? If you look at it very closely, you will see that the group of neonates that are actually malnourished, the largest proportion lie between 23 and 25. And 25 is just really at the threshold. Meaning, if somebody is an interventionist and is interested in intervention, what does it tell you? It tells you that it is actually very easy to intervene in this population. With a little bit of effort, you can actually move a very large sum of or number of the neonates that are malnourished into the nourished group with very little effort, because the largest proportion of these are just at the threshold of the malnourishment and the nourishment, okay? So you need to be able to have an intuitive eye to see just beyond. So while people will be saying, okay, this is nourished, this is not nourished, this is nourished, you can be, as an analyst, as a data scientist, as an analytics, somebody who has intelligent eye, intuitive, interrogative skill, you'll be looking beyond just what you would look at it and look at it and look at it closely and come up with something. Remember, the data analytics is somebody who comes up with more questions, more possibility. He's not drawing conclusions. He's creating more possibilities. So if I were writing a report on this, I would be interested also in bringing a new dimension into this. Not only that we say, okay, yeah, just read the question, this, maybe you do a binomial, you say it's significantly different between this and that. That's not the end. We can say that an intervention program with minimal effort can be carried out to reduce the malnourishment in this population with the least ease. That's what this graph is also saying. This is a very interesting story that you can bring out from this graph. Okay, so these are part of the skills that you have to learn. You have to read a lot of text. You have to read a lot of other people's work. You have to read, you have to look into it, look into the charts, look at it, interpret, write out possibilities, be flexible, be flexible as much as possible and see possibilities. Okay, so this is the take home for today, intelligent interpretation. There's very little I want to say. I just wanted to give an example from real life data and what we're doing. We can see so many other things here, but not to take too much time, just to give that as a take home for today. Okay, so The next component of today's presentation is to look at the informed decision spectrum. And I want to introduce this to us. Clinical governance strategy, I tell you, in any healthcare facility or any healthcare delivery system that cannot bring about the functioning of a clinical governance strategy, why it will fail mostly is because, not because the doctors are not there to help, is because the health records professional is lagging behind. You know why? Clinical governance strategy is 100% data-driven. Now, the earlier we learn to understand what clinical governance strategy is, the better for us, because we will now help the clinicians, those who govern the decision of the hospital, to rely on us. This is where we actually shake the table, really. Okay? Clinical governance strategy is a quality improvement strategy in any kind of healthcare system, and it is the most superseding activity that can take place in any healthcare delivery system, okay? Remember, it is 100% data-driven. And once we mention data-driven system, data-driven activity, excuse me, we're talking about the health records professional, we're talking about the health information manager, we're talking about you and I, who are the data scientists, who are the data analysts, who are the analysts, because now you're growing to understand the skills. You manage the data, you maintain it, you confidentiality is in your hand. You're the data manager, you're a data analyst, you're a statistician, you're just right in the middle of it. Clinical governance strategy is a patient-centered quality improvement strategy. And depending on the system, some may have a clinical governance framework with 7 elements, some will have with 12 elements. It can be 5, it can be 10, it can be 1 component clinical governance strategy, depending on the system. So, but this is a very common framework in which you have clinical audit, sometimes called medical audit, okay? It helps to audit the system. This talks about professional development, that's staff, okay? It talks about clinical effectiveness, which deals with some of the clinical practices, clinical intervention strategies that are used in the system, how effective they've been. So quality assurance, of course, we've talked about managerial tool, preventive measures, developing tools and all that. Risk management, very important. It's a component that deals with how proactive risks are managed within the system, okay? So accountability is a means by which we present what we're doing. We're accountable. We give up-to-date information. People can go to see what we're doing. It's documented, okay? People can make reference to it. People can talk about it. It's not hidden, okay? That's basically part of what accountability is all about. Research and development, continuous part of it. And of course, again, the health records person is critical in research and development in any healthcare system, okay? So because the data is in your hands, my friend. So where you're gonna go, you must come back to me. But you're not gonna be arrogant about it. You're gonna develop your skills to be able to answer the questions. You're gonna be churning out information, producing reports, you know, without you have to be self-motivated, okay? So these are the things that we need as a data analyst and data scientist henceforth, okay? So this is a very important decision spectrum for which we would do analytics in the healthcare delivery system. I just needed us to know that, okay? The next very important activities that we can do, we can help the system do informed decisions, patient experience management, you know. If I ask this question now, you'll be so surprised. How many of us health records information managers in our various systems, various facilities that have decided to design a survey questionnaire for the hospital to understand how are experiencing us, how satisfied they are? Does it occur to you that this is also within the activities of a health information manager? Because it is data that is produced. At the end of the day, it's going to be analyzed and a report will come out of it. Or maybe because we work in a government hospital, there's no need for us. After all, it's government. After all, you're sick, so you just have to come to the hospital. Whether you're satisfied or not, you don't care. And because it's government, most of us are in government clinics, so there's no need to develop the business really. What is there? Anytime the CMD decides to bring MRI, fine. If it doesn't, so but well, Let me advise those of us who are in private system, if you're a health record information person and you're in a private system, you would have to carve a niche for yourself. Business development is a very important component of private hospitals, even in government. I'm just trying to be, this government thing has actually caused a lot of problems for us. But okay, if you are there in the government system, you have opportunity of, sharpening your skills. There's a lot of data. You can look at, you can even look at your referral system. And from referral system, advise the management of that organization that, look, do you know that we refer up to 300 people from this clinic to do MRI in or X-ray in that other facility or that? Can we just set up an MRI in this hospital, and that can help business grow, expansion, and we can make more revenue, okay? So these are some of the things that are within the purview of a health record, because you're a data scientist now, you're a data manager, you're an analyst, you trump up things, you bring up possibilities, you're not drawing conclusion, but you allow people to, you trash data, you bring out possibility, you give deeper insight into the things that are happening within the system. And this is a call for this course, okay? So ultimately, again, it's important to learn the skill of reporting. Reporting is a very important skill. It's the overall outcome of what all the activities, all the things that we're doing, and it has to be documented. You have to put up a report. I wish I had a very typical report I would have shared with you. Ultimately, you need to learn to be churning out reports. Okay, I can send you a link of an open source. There's a clinic we're working, and the patient experience survey reports are actually put online on the website of the clinic, so that it becomes transparent. There's accountability in that particular system. Patients are more comfortable interacting with that kind of facility because the facility reports its patient experience satisfaction survey report online on a periodic basis. So they tell the patients what we have done, what we have received from you. We are very grateful, and this is what we have done, and we have worked on it. Do you know that out of curiosity, some patients might just decide to go to the hospital to see how they've implemented that, interventional strategy to improve on the skills, So these are very important components. So by and large, all the analytics you would do, you would have to be able to learn the skills of reporting. Again, we would have opportunity to have a session where we can learn how to put up a report, a very good report. Reports that are just beyond the key indicators, okay? We're trying to move slightly farther away. We need to learn this. This is basically the reason we're holding this course, to know that beyond just these key indicators that you prepare, okay? Every day, bed occupancy rate, mortality rate, morbidity rate, immunization uptake, these are basic indicators. Of course, you take that, you do all that. But beyond that, you can manipulate, you can cross reference, you can make a lot of insights even within these key indicators that you're developing every time you generate these reports. Okay, you can go further, look into, for example, there was a report we did some time back, and we're trying to say some beds have been highly used, and there's no maintenance record to show that those beds have been maintained with the past. In fact, there was a time we realized that because of a room's position to the sun, we found out that some beds are more occupied in that room than the other beds. Why? Because that bed that's not used is at the window side, and the sun usually comes in that. These are the kind of insights you get from it, from in-depth analytics. And it helps management to take decisions. So your reporting of details just beyond the indicators help management to do reviews, take certain decisions. So what happened that time, they had to change the blind. They improved on the blind in that room so that sunlight doesn't disturb patient using that bed. And so, it is hoped that bed and the other bed that has been overutilized, there was a call for it to be to be looked at so that they can, maintain it, okay? So you have to look at modifiable standards of reporting. So you can modify it. Standard framework for reporting will certainly include a summary. You have an executive summary at the beginning, and you have an introductory component of that report that, first of all, highlights the objective, the reason for that report, and what is expected in that report, okay? It's very important. Then you now systematically break your reporting to, start from general to more specific, okay? If you're doing a hospital activity report, of course, it means you're expected as HOD records to have once in a while, maybe this 6 months report in which you report all the department's activities, pharmacy, laboratory, diagnostic x-ray, so you follow it systematically. Systematically meaning that, of course, you start with how many new patients came in, how many old patient repeated visits, how many are female in our database, how many are male, how many are children, okay? How have they patronized us for the last 6 months, okay? So you're talking about consultation load, okay? And then we talk about traffic to the lab. We now talk about the maybe 5 top 10 laboratory tests. Of course, Widal and NP will come up top, all right? So it helps to tell management exactly what is happening with it. So you can produce a summary, you can produce it in charts, you can do a lot of interesting analytics, and we would have interesting progress in skills and development in analytics. Thank you for listening, and I think we've been able to exhaust today's class effectively. I hope so.